Welcome to this World Extreme webinar with myself, Owen Walker. In this episode, we're looking at top tips in the tropical environment with Laura MacArthur. Laura is a locum and a remote GP, and she is also a lecturer on the MSc in Extreme Medicine at Exeter University. So what we're going to do in this episode is look at Laura's top tips working in tropical environments from her anecdotal experience across the globe. We're going to look at a number of modalities and indeed tips and tricks that Laura has picked up from working in various locations and indeed treating various patients from these locations. So what we'll do is we will look at her reflections, we'll look at a few case studies, and indeed we will look at what has and hasn't worked in this environment. Laura, it's over to you.
Oh, thanks, Erin. So yeah, I will get my slides up for you. So let me know if you can see that okay. Happy?
That's absolutely fine. Yeah, we've got that. That's perfect.
Okay, so as Erin said, yeah, I'm a GP, tend to base myself in Cornwall, but also work intermittently in Scotland, remotely on some of the islands, and then yeah, work overseas in various places. So I also lecture for the Extreme Medicine Masters and do some elective advisory work for Plymouth Medical School, and I obviously work alongside WEM as well. So I'm currently in Fiji doing the medical support, so GP and emergency cover for a TV show out here. So what I'm not an infectious diseases consultant. I'm not a tropical medicine consultant. And if you want to know the, I don't know, last IV treatment possible for leishmaniasis, I am not your go-to person. This is much more aimed at what to do when you are working in low resource settings. And really, I guess, yeah, as Owen said, what I've learned along the way about myself and how to manage myself in these environments, and really passing on some of that knowledge on self-admin, self-management, and also patient management. So I've sort of broken it down into these various categories. So as I say, self-care, so self-admin, the practicalities of traveling to the tropics, because they are often challenging countries that you're going to. Thinking about your target treatment population as well, so whether that's locals or expedition clients, then your medical skills and knowledge, what specifics do you need for the tropical environment, and then thinking about systems and equipment and yeah, other resources that I'll direct you to. So self-care, as any good tropical doctor knows, know how to put your hammock up. Otherwise, you can suffer hammock trauma. Very important. So these are just really some basics. So heat rash, real problem. Get a scrubber, one of those little loofahs, take it with you. You might think it's a complete waste of space. I promise you it's not. You need to be able to clean the skin down and remove the sun cream, the bug spray, the grime that you will get on you from the tropics. Try and use biodegradable wash products. Most tropical countries are going to be suffering from climate change. They don't have a lot of the sanitation plants that we might have in our home countries, and just being conscious of what you're putting into their water systems is really important. So not to be a burden on them as much as you can. Carry alcohol gel everywhere. I think a lot of people do this post-COVID anyway, but particularly in the tropics, there are bugs everywhere, and you will get something on your hands. So just always have it on you. A sarong is an extremely important bit of kit. And everything from changing under to dousing in water, putting it on your head, stopping sunburn, sitting on home visits. that I go on at the moment. You don't always want to be kneeling on the floor in some places, so very useful for that. Useful for a towel if they're quick drying. Doesn't have to be an expensive one. A flask. So I am quintessentially British in this way. I don't go anywhere without my flask and tea bags because I get grumpy. They're not even caffeinated, but just beware taking your home comforts with you, because when you are a bit tired, you're a bit hot, you haven't slept well, actually a cup of tea in the morning sorts me out. So yeah, whatever your go-to is. Buffs are really good, again, very good to keep hair out of the way, stop sun cream sweating and going into your eyes so that it stings you can't see. If you are lacking in the hair department on top, very good for keeping sunburn off your head. Also really dusty, so you can put it up above your nose if you're on mopeds, if you're walking along a dusty road, if there's traffic. Merino, this is really interesting. So I learned this when I was working in Darwin. Merino and wool isn't something that you would traditionally think of the tropics, but actually it wicks the heat away. So depending on what you're doing, often I will wear a merino top underneath whatever my uniform is on top, and actually I stay much cooler than a lot of my colleagues who are just in one layer. So natural fibers, really important. Practically, unlock your phone. If you can get an eSIM, check if it can have 2 SIM cards in. Things like medication, so doxycycline, a lot of people will react with sunlight when they're taking it, so just if you're not taking Malarone as your anti-malarial, do try doxy. Other ones can give you mental health issues, and if you haven't trialed it before you've gone away, that's a bit risky, so just trial it before you go, but Malarone is generally quite safe. Coke. So I sort of bury my hands at my head in my hands when I put this on here, but anecdotally I've spoken to a lot of people, and certainly a lot of my lecturers when I was doing the Trop Med diploma swore by it. I swear by it. So this is definitely not a Coca-Cola. Ultimately it dissolves chicken breasts. We can clean boat toilets with it, and have you ever seen the coin get completely clean by putting it in Coke? So I tend to have a can of Coke a week whenever I'm working in a tropical environment. For me, anecdotally, I think it probably just keeps any minor gut stuff away. And particularly if I'm in a position where I'm leading, or if I'm in a position of responsibility, I can't really get sick. So I use it as a bit of a preventative measure. It's also relatively hydrating. Definitely not promoting it, but at the same time, if you've just got that bit of a tummy gripe, that's not enough to be something, an illness, you're not sick with it, but it's pretty uncomfortable and you're about to get on a bus and travel 10 hours, or you're leading a group into the jungle, actually sometimes I'd much rather have a Coke than I would antibiotics at that stage. Deworming is an interesting one. So depending where you're going, what you're doing, just consider actually whether you do want some deworming at the end of your trip. So I'm often away long enough that I will use something like albendazole at the end of each trip, just so that I know that I've dewormed. The Aussie military give their troops deworming tablets routinely when they get home from tropical environments. So a consideration, not a necessity. Just consider your diuretics. So alcohol, coffee are dehydrating, and caution around local alcohols. So talking about sleep, so bed nets, really important. One, to keep beasties out, like rats that you can see, snakes, but obviously also mosquitoes, and often they will have holes in, so safety pins are useful just to get those holes sewn up. But also anyone who's interested, have a read of Matthew Walker's book, Why We Sleep, and tropical nations. We all think that they are having a bit of a snooze and, oh, it's very nice to have a little gap in the middle of the day. But there's a lot of evidence that shows that the Western world is having a bit of a sleep epidemic, and we should probably be listening to them. That's probably all I'm going to say on that. But really interesting if you want to look into it. Hydration. So Owen, I think I learned this from you. 2 is 1, 1 is none. That's your saying. So think about what you're going to use for your water treatment. Don't rely on one thing. So I will tend to use a UV pen and chlorine as my go-to. Obviously depends on the environment. If you're going away for a long time, the bladder systems might be great for height because you can just constantly sip, but actually how are you going to clean that water bladder pipe? Unless you've bought the pipe system, you're going to get loads of mold in there very quickly in a tropical environment. So just have a think about how you're going to manage that. You are going to drink more, you need to drink more. I know that in the UK as a GP, I will drink 1 litre of electrolyte a day, whether it's summer or winter, and then probably drink another one if I've gone for quite a heavy run. So out here, I know that I need to drink at least another 1 to 2 litres of that. Yes, you can just drink water. The evidence in certainly sports people when you're under stress. So that might be I don't know, someone who isn't used to a tropical environment, isn't used to exercising, and suddenly they're hiking and they're in a tropical environment. That is their body under stress. You will absorb more water if you have electrolyte, and these 2 links are evidence of that. So the Australian Institute for Sport have got quite good fact sheets on that. So yeah, a bit of salt, sugar, as well as water is really important. And this was some work done by one of our other WEM faculty. So he's in the military reserves and looked at hydration and tied this in with the WHO diarrheal guidelines. So you can see they're huge amounts, and you don't think you'll drink that much, but you do need to plan accordingly, and think about your acclimatization period before you go off and do something fairly major like an ultra run or hiking across Panama from coast to coast. If you're in an environment where you can adapt and just add water, so easy access, fine. You can just see how much you're needing, but if you need to think about where your water's coming from and how much you're carrying, that's a little bit more complex if you don't know what you're like in the environment. So moving forward, so food, I've put pork specifically on there because that picture in the corner is of neurocysticercosis, which is pork tapeworm, and the cysts are in the brain. So the most common cause of epilepsy worldwide is due to pork tapeworm cysts in the brain. I don't eat pork outside of the UK. That's not to say you can't. Outside of Europe, sorry. But I personally just like to know where my food has come from, what treatment it's had, and you just have to consider slightly when you're in some parts of the world whether there are cysts in the fish, the shellfish, the other meats, and just think about it. So it's not a don't go there, you just need to be aware of it. And the old age, wash it, cook it, peel it, is really important. So particularly in markets and things like that, where you've had local people who aren't adhering to food standards necessarily are creating lovely meals, and they always are, but your gut isn't necessarily going to be immune to the bugs that are just naturally around, and locals will be used to. So salads, fruits, juices, all the nice things are often a bit of a no-go, and it should generally stay to cooked stuff if at all possible. Once you've been somewhere for a little while, if you're living somewhere for 6 months or whatever, fine, you might vaguely start to introduce stuff. If you're going for a week or 2 weeks, I just wouldn't bother, because I would want to be sick for the entire trip that I'm away. Dairy, again, if you've got a bit of gastro, not a great idea. And just be aware, obviously, how long things have been sitting out for in the heat. So bugs. So just moving me out the way. Know what works for you. So I was always a massive DEET fan, and it was always drilled into me it's absolutely the best, and evidence is that it is. However, I have to say, I've worked in places all over the world now, and particularly in Fiji last year, I was using DEET at the start, and these mosquitoes must have little bulletproof helmets on, because nothing was stopping them. And then I thought, I'm just going to try various things, and actually it turned out that the natural mix that they have here does stop me getting bitten. DEET doesn't. Whether that's my particular skin mix with the oils that I'm giving off, I don't know. I haven't got science behind it, but I just know through my own personal randomized control trial that X spray works here for me, DEET works elsewhere, and I don't have an explanation for that, but just bear that in mind. So something like Avon Skin So Soft works very well against the midges in Scotland, and then DEET, it's okay, but actually it can damage your skin, it can damage clothes. So if you don't need it, just see if there are other options. But as I say, DEET is the evidence-based thing that works. Bed nets, really important that they're permethrin treated, because actually it's not the barrier of the bed net that stops mozzies biting necessarily. There's a lot of evidence that's shown that actually even someone sleeping in the same room as someone under the bed net is protected, just because that mosquito comes and touches the treated permethrin bed net, doesn't like it, and goes off, and doesn't bite the person in the room who isn't under the net. So make sure that they are treated, because that's the bit that's doing the job mainly. Sunscreen, so just make sure that you put sun cream on first, wait 15-20 minutes, then bug spray. Don't get the combination ones. There's things in both that stop them working, and you might not always want both. I wear factor 50 in the tropics, but I burn easily. Obviously, everyone's a little bit different, but I wouldn't go under factor 15. And you obviously want something that's UVA and UVB. That also goes for sunglasses, protecting your retina. And again, evidence isn't brilliant, but there is some evidence that skin lotions, sunscreen lotions, are better than oils, because the oil can seep further into the skin and actually won't necessarily protect that top layer of skin. So I would always go for a lotion rather than oil. So the lovely bit, hygiene routines. So very glamorous, or just wash if you can, particularly underarms and in the groins. Those are the sweaty bits. Those are the bits that get chafe. Those are the bits that get your fungal infections, your heat rash first. Don't shave if you can avoid it. If you are desperate, then try and make sure that you're somewhere where you can regularly clean in clean water, so showers. A lot of places won't have that. So if I was out in the middle of the Amazon, there's no way I'd be shaving, because if you have a ingrowing hair, if you cut yourself, that's potentially a septic wound that is a medevac for you, plus or minus other people. So minor cuts can go septic very quickly. I've already said about alcohol gel. Contact lenses, wear dailies if possible. There are also collection sites now for lenses for recycling. So do bear that in mind. If you're wearing monthlies or hard lenses, you need to be ultra careful with hand hygiene and have somewhere super clean to be putting your lenses. And eye infections are really common, so I avoid it at all costs if you can. Then things like body glide, so a lot of ultra runners will use it on areas that are going to be friction, so underneath their little running packs, but often between the thighs are areas that rub, so if you're in shorts and walking, so again, just anti-chafe creams can help that. But if people do get heat rash, then calamine lotion, so as we used to do for chickenpox when kids were little, or topical steroids, so something like hydrocortisone. And obviously you need to think about your bathroom facilities. So, you know, looking at all of that and the things that I've just mentioned, how on earth are you going to do those things in these environments? You know, this top one's the middle of the jungle in Costa Rica, as is the bottom one. Those are our cooking pots. You know, you want your alcohol gel. There's what, I don't know, 15 odd people there who are dipping their hands in. The bottom right is in Papua New Guinea, and again, you know, multiple houses on stilts. In the wet season, the water will come up. If you're living in that environment, you know, what is the toilet situation? How are you washing? How are you cleaning? You know, it's a real problem. So foot care, so really make sure you've got the right shoes. Assume that your feet will swell, so at least to a size, if not a size and a half bigger, and assume then that your feet are also going to be wet, so your socks are potentially going to expand and also rub. So having shoes that are the right fit at home and not necessarily the right fit in the tropics. And think about what socks you're going to wear. Have clean, dry socks for night if you're, you know, somewhere and you're in hammocks in the middle of the jungle, or if you're somewhere where you can be anything free off your feet. So just skin, then great. Dry your feet out at night. Know your foot routine and know your feet. So having a little plastic bag of talc to dip your feet in at the end of the day just staves off any athlete's foot, and obviously any then secondary infections from that. But know whether your feet are sweaty feet, dry feet, and where your hotspots are, because you don't want a blister. Definitely use rock tape or brown parcel tape to go over those hotspots. Once you've got a hotspot, really you need the rock tape. If you know you get a hotspot and you're just doing the prevention, in theory you can use brown parcel tape just to let it slide, but you need to be very conscious that that's not then turning into a hotspot, and keep toenails under control. Clothing, so I've touched on this, but it's kind of the obvious. Obviously comfortable, loose fitting. I said about merino before, so it is very good at wicking. If you're somewhere where it's going to rain and you haven't got a way of drying it, it really doesn't dry that quickly, particularly in the humidity. So you need to think about where you're going and what you're doing. So polyester t-shirts are brilliant, but you're much more likely to get heat rash under them than you would do a natural fibre. Whereas a cotton t-shirt, a merino t-shirt, is going to be better for your skin, but it's not going to dry as quickly. So it is a little bit of a trade-off, and that's why, you know, often you see a lot of people in the safari shirts, because they tend to dry a bit quicker and not be too skin irritant. You can get permethrin treated clothes, and obviously dawn and dusk you want to be trousers, long sleeves to avoid the bugs, and depending on where you're going, particularly as a female, just be mindful of religious considerations and whether you need to be wearing certain things. So personal comforts, back to the tea. You can see that I'm tea obsessed, but it's true. I think if you're if you're, yeah, as I said before, tired, hot, hungry, you've had a long day, you're muddy, you haven't been dry in 3 weeks, whatever it is, some of these things can just be a little bit of a pick me up. No one likes a grumpy crew. So yeah, for me, tea bags, you can get tiny little things of hot sauce, which turn very bland, meals in a bag, or if you're over just rice, it can just add a little bit of flavor to it and pick you up. Again, I think oral hygiene is really important, because there's very little that most of us can do about teeth when we're away. Those of you that have met Burj, our World Extreme faculty dentist, will have learned a lot from him, and his lectures are well worth listening to. But I think a lot of us would say, we're not confident dentists. So I think if you have got the opportunity to have an electric toothbrush, go for it. But certainly make sure that you're keeping your toothbrush clean. Electrolyte tablets, as I say, I swear by. I feel much more hydrated if I've had them, and the evidence does support that. Headphones are really useful, if you're sleeping around a lot of people and they are noisy sleepers, it's very helpful to have something to drown them out. And if you're spending a long time in a hammock in the rain, it's nice to have the distraction of an e-reader or a little bit of music, something like that. Then be culturally aware. So for you, for example, the other week I was out with some of our field crew here, and we were cutting some trails, and I was sort of trauma support because they were on a bit of a cliff edge, using machetes, chainsaws, all the rest of it. We're pretty remote where we are, but they just leave the machetes on the ground when I stood on one. So that they are used to working in a certain way with machetes. They've been around them since they were 5. I haven't, and I'm not used to wandering around and expecting to find a machete on the floor. I think most people back home where I'm from in the UK, we wouldn't leave a knife on the floor, so it never even occurred to me for it to be something to look for. So do just be slightly aware that there are different practices, and also if there are people using equipment like that, they are far more used to using it than you are. So keep away. You don't know what they're going to be doing. If they're denutting trees for the coconuts, don't stand underneath looking at the coconuts because they're going to fall on you. It sounds obvious, but do just be aware of local customs, and what you're doing. Practicalities. So this was a river in Papua New Guinea, and I only found out when I got to the boat that this was all too shallow for the boat to get to. So we were walking through, and there was little double-streamed bubbles coming up, and it was only when I got onto the boat that I found out that those were the crocodile nostrils. So we'd been walking through this river, and there was God knows how many crocodiles around. So there's often interesting commutes, and this was probably about half a kilometre of just mud, sometimes thigh high. You're carrying medical kit in and out. It's not always the easiest. Let's put it that way. But some of this will be quite basic for some people who have travelled a lot. Others, this might be new to you. So particularly in the tropics, because of the countries that you're going to, always have copies of everything, whether that's passport, driving license, visas, etc. You might not always be able to get on an airport Wi-Fi. They might not have one. The electricity might not be reliable. So have the printout. Whilst it will get sorted if you've got an electronic copy, it's far easier just wandering into customs with your paper sheet when the internet doesn't work and you don't have to wait the extra 5 hours to have the discussion. I'm up for a bit of an easy life. So always have a battery pack. Your phone will go down quicker in the heat, but obviously also you don't always know when you're going to have an interconnection, a charger, an electricity connection. And always just check what the adapter that you need is. Again, sounds basic. You'd be surprised how many people come out here and have the wrong one. Always bring your vaccination certificates, particularly yellow fever. Some countries will not let you in. I think everyone's a lot more accustomed to this now since COVID. But just have a copy, then you don't have to have the discussion when they ask for it. So I think having stuff written down, having family members at home know where you are, where you're expected to stay is really important from a safety point of view. And then things like don't have all your valuables in one place, have a decoy phone, so that if you are mugged, you can give them the decoy phone and the wallet with £30 in rather than, I don't know, 400. It is basic, but a lot of countries in the tropics, these are things that are really important to consider. And then think about your target treatment population. So are you treating locals? Are you on a project, or are you treating tourists? Because the approach is quite different, and the expectation will be quite different as well. So think about how long you're staying in the country as well. So, and be very conscious, is this medical tourism? Are you going for you, or are you going for the people? What's your reasoning for going? And I would say, if you are staying somewhere for a long time, 3 to 6 months or longer, then your approach is going to be very different if you're going for 2 weeks to a month. Underlying medical issues need consideration. And so, for example, antibiotic threshold, if I'm trying to get someone through an expedition that is 2 weeks long, they're trying to get up Mount Kilimanjaro and they're only in Tanzania for 3 weeks, my threshold to give them antibiotics is probably going to be a bit lower than, for example, where I'm working at the moment, where I'm here for 5 months and I can see someone every couple of days if I need to, and I don't want to be contributing to antibiotic resistance in the local population. So your mindset might be very different depending on what you're doing. And then you obviously need to think about sort of international strategies rather than just doing your own thing. So for TB, HIV, malaria, there are often either countrywide or international programs. So if you're not sure, speak to wherever you're going to and ask. And if you're really not sure, then I'd question, the organization that you're going with, because you shouldn't be hampering or taking away from that local population. You shouldn't be a drain. So, for example, the picture on the left is a lady having the implant put in. So this was a charity that goes multiple times to Papua New Guinea every year, and has been seeing some villages for about 10 years. So putting in an implant, we know that there will be someone there to take it out. So there is follow-up. On the right, same charity, TB screening. So they don't get involved in treatment, but they do help with screening and feedback the figures and the patients to the government for the local TB team to come in and treat. So there can be a halfway house. So then your medical skills and knowledge. So clinical reasoning, so important, I think, for anyone working remotely, but particularly in the tropics, because it's a minefield. A fever can be absolutely anything. So the jobs that I think I would recommend people do to upskill, to work somewhere remotely and in the tropics: general practice, emergency, orthopedics, obs and gynae, and peds, I think, are probably the most helpful. You can do other qualifications. So obviously we run expedition courses, and a lot of those skills are for expeditions, but also for remote area practice, and aren't really things that are covered elsewhere, I think, in any training curriculum, certainly not in the UK, unless you go and do like the rural GP fellowships and stuff, and or have a wandering career like I have and found your skill set along the way, but you have to drive that. So yeah, these are obviously official qualifications that are helpful to have. So yeah, the diploma in tropical medicine is run in a few places in the UK, and abroad as well. I am doing another talk on the surgical sieve for the tropics. So just having an approach to the diagnosis and management of tropical diseases. You can either use mine or not. I don't mind, but just have an approach. And then just being aware, I think. So the number of people who think they have a vaccine and then they are immune, that's not the case. And I think awareness of that is much better since COVID. But for example, the typhoid vaccine might have 70% efficacy after a year, and then it goes down to about 40% after 3 years. Well, that's, yeah, it's something, but if you drink a glass of orange juice and it's got typhoid in it, you're still going to get sick. So just an awareness that you haven't ruled out a diagnosis because they've had the vaccination. And then occupational awareness as well. So this is what I love about tropical places. Everyone does cool stuff and gets injured. But so the picture on the left is a stingray barb. It's obviously a fishing hook in someone's foot. That was the other week. That was here, but it was a fairly sizable one. And the bottom picture is mango pickers dermatitis. So if you saw that rash and I was at home in the UK, I'd never think about mango juice going on, mango sap going onto someone's skin. If you're in the Northern Territory in Australia and you see that rash, that is very much relevant, because they see little epidemics of this every single year because the sap is highly irritant. Stingray barbs, what do you do with that? Unless you've looked up, you're used to doing it. Everyone just looks at it and goes, oh, okay, that looks quite cool, but what do I do? So again, fishing hooks, really, fun thing to take out. But unless you're working somewhere where this happens regularly, you might not know how to do it. So before you go somewhere, have a little think about, what the occupations are in that area. Speak to locals, speak to the local medical team, find out what the normal presentations are, because there will be a pattern. And, a lot of them will know what to do. So learn off them. And the other thing I would say that I think people don't always know what to do with is getting bugs out of orifices. So particularly the ear. Another reason to use your bed net. So getting bugs out of ears, how to remove a tick, think about how to remove a botfly, recognize those common skin infestations as well. So things like snake bites, everyone thinks is going to be really obvious. They're not. They can be 2 little pinpricks, and it can feel a little bit like a blade of grass scratching you if you're walking through scratchy grass. So just look into these things, speak to people around you, and know what to do with them before you go, because they will all be things that you will see in the tropics. And then know the beasts. So I know that this is a Southern Pacific boa, and that this is a non-venomous snake. So I can hold it, and I'm quite happy. But unless you're around locals who are very much experts, I wouldn't necessarily do this. But know what is there, and know what you're going to do about it if you come across it. Know the local practices and the nomenclature as well. So there's often lingo that will go over your head for a little while, and then you'll find out what it is. So for example, the linear cuts on this little one's head is a practice for fever in Papua New Guinea. So the mums will cut the head because they believe that it lets the fever out. If you see cuts on a baby's head, that is not my go-to assumption, or certainly wasn't. So just be aware of cultural practices. And have a plan for heat illness. So this is a really big deal, and people, particularly Brits, always think they like being warm. But it is probably the one thing in the tropics that puts the fear of God into me, is someone overheating, because it is very difficult in some places to cool them down, and it can kill you, and it can kill you really fast. So have a plan for heat illness wherever that is. If you're somewhere miles from anywhere and you're lugging your own kit, a little plastic bottle, spray bottle, and plastic to waft over them is really effective. If you're somewhere where you've got transport, then you can get an esky or a water cooler, fill it with ice, cool box, that's what I'm looking for, and water, put ice towels in it. If someone is suffering from heat illness, they get a cold towel dunked on them, and that can be your stage 1 of treating them. So just depending on where you are, depends on how effective your treatment can be and how quickly you need to get out of that situation. Steroids, I won't spend long on this, but ultimately just be really careful in local populations in the tropics. They have, depending on where you are, will depend on the rate of strongyloides, but in essence, people can get extremely sick if you give them steroids and they have strongyloides infection, and they won't always know. Loads of them will be asymptomatic. So if I'm going to give someone local steroids, I would generally always treat them with ivermectin first, depending on where I am. And certainly in Fiji, that's what I do, because the rate is so high. So just find out where you're going and what the likely rate will be. Know your boils, because you will see them everywhere. The one on the left is yours, and is rife in Papua New Guinea. Very simple, quick antibacterial treatments, antibiotics. The other two are emerging boils under the axilla. That top one I probably wouldn't treat. The bottom one, our sort of guidance, if it's recurrent and it's over 5 centimeters, then we'll tend to give them a course of antibiotics. But again, just check what your local guidelines are, and try and adhere to them where you can, so that you're not contributing to any antibiotic resistance. I'm going to say if you're a doctor, because most nurses and paramedics are already quite good at this. But no, jokes aside, be able to draw up your medication. A lot of doctors aren't used to doing this. So I would just say, if you're not, write yourself a little cheat sheet and laminate it, because no one particularly wants to be a clever clogs, and you've read it a couple of times and you think you can remember. If it's not something you do every day in, day out, just write it down and laminate it, and then there's no errors when you're in extremis under pressure. And I would just say do the same for any emergency protocols as well, or things that you're not sure about that you're always going to want to look up. Better safety. Then systems and equipment. So the tropics, interesting, no electricity there for sure. So what is going to be your cold chain? If you're doing a vaccination clinic, if you've got a diabetic with you and they need to keep their insulin cold, if you have chloramphenicol that needs to stay in the fridge, if you've opened antibiotics, like amoxicillin for kids, the suspension ideally needs to be in the fridge. Most medications don't like being over 25 degrees. Here we're at least 28 degrees every day. So how are you going to keep stuff cold? What's the stability of the medications that you're taking in the heat? Have an awareness of the hospital facilities that you're potentially going to use, and aware of the transport links. So an ambulance doesn't always mean an ambulance. It can mean a truck and it's just empty in the back, and they will put someone in the back and drive them to hospital. That is often an ambulance. and a helicopter retrieval might be 24 hours whilst the insurance companies have a little bit of a chat. So don't assume that helicopter is going to appear in the next hour. This isn't London Hems. They don't appear that quickly. So assume that you don't have that. And then if it arrives, great. Yeah, that's a bonus, isn't it? And then just have a think about your investigation. So when I was working somewhere in Tanzania for, I don't know, a couple of months, I eventually went into the room where they'd been doing the urine dips and they'd actually run out, but they were too embarrassed to tell us. And so they'd just been writing stuff down and, you know, mixing it up. So don't assume that what you're asking for is potentially what you're getting. I think it's safer to go through literally the whole process of what you're doing, asking for, seeing with your patients, and learn what everyone is doing, and then you know what works and what doesn't work. And if all else fails, or you just want to chat, then phone a friend. And obviously you're always welcome to email into WEM, and there is a whole body of people who may or may not know the answer, but we'll certainly try and find someone who does. But these aren't exhaustive, but what I would do before I go somewhere is build up my go-to resources of, oh, if I need to look that up, where am I going to look? Because on dodgy internet connections, it's not always the best to be trying to, you know, go through papers and stuff in Google. So just have your cheat sheet again for the resources that you're going to. So in summary, we've gone through self-care and self-admin. We've looked at the practicalities of tropical traveling, and we've had a bit of a chat about how it might change depending on whether you're treating locals or your expedition sort of short stay population. Have a think about your medical skills and your medical knowledge. We've looked at systems and equipment, and obviously just said about the resources. But ultimately, working in the tropics is really fun and everyone should do it. And that's it.
Laura, listen, that's fantastic. Really wide ranging there, and encompassing of lots of different, not only pathologies, but experiences. And something you were just saying, which was absolutely fascinating, is around, like you said, phoning a friend. So getting a second opinion, because sometimes that just really does open your mind to differential diagnosis and indeed things that you might not be thinking. Another thing you said actually as well, which is absolutely spot on, which is around taking care of your feet, because it can be the differentiator between what might be a fantastic experience in a tropical environment and a really difficult one.
Yeah, 100%. And everyone likes the photo of Crumpet Foot. It makes a very good Insta picture, but it's not very fun. It's not worth it.
Listen, Laura, thank you for your time today, and we will catch you on the next webinar, which will ensue shortly.